Welcome to the Hospice Education Podcast, where we explore essential topics in health and social care. Today, we're focusing on Parkinson's disease. With roughly 160,000 people with the condition in the UK, we're going to explore more about the condition and how to care for somebody living with Parkinson's. This episode is about comfort, dignity, and person-centred support, not just the medical aspects, but the practical ways in which we can make a difference. I'm joined by Catherine O'Brien, who has extensive experience in end-of-life care and in Parkinson's disease. Welcome, Cathy.
Welcome, thank you.
Could you just let our listeners know a bit about your background and your experience with end-of-life care and Parkinson's disease?
So I've worked in health and social care for my whole working life, which is about 40 years now. And for the 12 years before joining the hospice, I managed a service for frail older people, many of work supporting them right through to the end of life, many of whom who were living with degenerative conditions such as Parkinson's disease.
Okay, great. So let's start with the basics. What does Parkinson's look like and what causes it?
The simple answer to that is that Parkinson's is a progressive neurological condition. It means that it causes problems in the brain and there is no cure for it. There are treatments, but there is no cure for it, and it will get progressively worse over time. The cause of it is that people don't have enough dopamine.
Okay.
That's a chemical that we need in the brain, and because of that, some of the nerve cells in their brain will die. And without dopamine, people will find that their movements get slower and it will take them longer to do things. We don't actually know why at the moment people get Parkinson's. There is a lot of research being done on that, and Parkinson's UK is an excellent resource for people who might want to do more research or understand the research that is happening.
Okay.
But what we do know is that it is probably a combination of genetic and environmental factors that cause the dopamine producing nerve cells to die.
Okay. So how quickly does the condition progress?
That will vary from person to person. No two people's journey is the same.
Okay.
There are a lot of factors that can impact a person and their journey with Parkinson's, such as how long it is before they get a diagnosis,
Sure.
the support network they have, how well they interact with and accept a treatment plan. So there are a huge number of factors that can impact on the person's journey with Parkinson's. Also, any other underlying health conditions they may have as well.
So let's just talk through some of the main symptoms of Parkinson's disease.
Okay, so the symptoms that people perhaps will be most familiar with and know most about are the tremor.
Okay.
But it's not always a tremor. It could be stiffness, it could be slow moving, it could be mood changes, it could be excessive salivation, it could be bowel and urinary problems as well. And I say it could be because, again, as I say, the impact on people will vary, but a tremor is one of the ones that is most commonly recognised and will often start on one side of the body but may spread to the other side as the condition progresses. So, but there are a raft of other symptoms that we are aware of as well.
Okay, and so, with the symptoms looking so different across, individual patients, how do we sort of treat Parkinson's? What are the main areas that we focus on?
I think the first and most important thing is diagnosis.
Mm-hmm.
And a diagnosis has to be done by a specialist.
Okay.
You do need to have a neurologist, and you do need to have a doctor who is experienced in working with Parkinson's. Once you've got that diagnosis, your specialist doctor will decide on a medication regime for you.
Okay.
And without going into the medication too much, the most common medication is one that actually replaces or acts as if it is the dopamine in the brain. So there is a suite of drugs. They're recognisable because they contain the word dopa. So there is levodopa as a drug, but there is a wide range of medication, and it will be each patient will be assessed individually and the medication will be tailored to their specific presentation of symptoms, and it may be tweaked over time. So that is one of the most important things, as good an early diagnosis, working with your doctor and getting the right medication to meet your needs.
Okay.
In addition to that, it is support with other aspects of daily living. So activity is important, keeping mobile, doing activity that will help you to keep as independent as possible for as long as possible. Social support.
Okay.
So social isolation, if you're isolated and you're not getting out and about, that can affect your mood. And we know that mood is a factor within Parkinson's anyway. So social support is particularly important. And so are the therapies. So physiotherapy and occupational therapy to help with your mobilisation, to help with the tools of daily living that you might need as well. And also, as your condition progresses, the speech and language therapy team, because you may have issues with swallowing, and they can support you with that as well and advise you on the correct way or the right way to help with that.
Okay.
Parkinson's will develop or can develop gradually over many months, and in some cases it can be many years before the symptoms become particularly tricky for a person to manage.
Okay. And, obviously a lot of our listeners are in the health and social care profession. So what does all of that, the symptoms and the treatment and the progression, what does that mean for the practical care of that patient? How can we tailor the care that we give in a palliative setting to people with Parkinson's disease?
I think the most important thing from that point of view is to have a flexible person-centred care plan.
Okay.
We talk about person-centred care, and for a person living with Parkinson's, their symptoms may vary hour by hour, day by day, week by week. And so we can't be too rigid in that care. We need to meet the person where they're at and adjust the care so it according to their needs. So it may be that in the morning they feel more mobile, and by lunchtime they need more support with mobilisation and different equipment. One of the most important things when caring for somebody with Parkinson's is making sure they get their medication on time.
Okay.
It is absolutely crucial that they get their medication on time. So if their medication is prescribed at 8, 11, 2, 5 and 8, they need to have it at exactly that time. They can't have it half an hour late, because by then they may be feeling the impact of their symptoms.
Sure.
People living with Parkinson's will often talk about feeling switched on or switched off. And the switched off is when the effects of their medication begins to wear off, and they might feel that they can't do things. So they can't eat independently, they can't walk independently. They may actually feel as if you're talking to them from the end of a wind tunnel, because they find it difficult to concentrate. And that's all to do with the impact of the medication wearing off or the progression of their symptoms. So the most important thing is the flexibility of care. And the other thing is to be vigilant to changes. So if you notice over a period of time that there is a worsening of particular symptoms, it is about making sure that that person is seen again by their doctor, so that the doctor can actually adjust that medication regime.
Yeah, hugely important. And I should imagine another massive thing with this disease is emotional impact. So, how can we support as, carers? How can we support communication and emotional well-being with these patients?
Meet the person where they are, recognise how they may be feeling. In terms of communication and effective communication, sometimes a person with Parkinson's, their ability to process information might be slower.
Okay.
And it might take them longer to actually process the information or the question you've asked and to actually give you a response to that. So you need to allow that time. You need to be patient. You need to be aware of your body language and make sure that you are giving them a sense of, I'm here, I'm interested, and it's okay for you to take your time.
Yeah.
When people don't answer in a conversation, we make an assumption that they haven't heard or that they haven't understood. So we do need to check both of those things, but actually If we're sure that the person is hearing and that the person has capacity to communicate, then we actually need to allow for the fact they just might need a little bit longer to make that communication effective for them. It's about looking at what their support network is.
Okay.
Are they socially isolated? Do they have they got family support? Have they got friend support? Have they got the right activity regime? Are they being supported to live their life as they want to live their life?
Yeah.
All of those things have a knock-on effect on a person's mood. And so we need to think about, are we making reasonable adjustments that enable a person to carry on doing the things they want to do as they want to do them?
Yeah.
And that can help. Obviously, if a person is struggling to come to terms with their Parkinson's or any other aspects of the impact on their life, then they may need more specialist support, counselling or guidance.
So what strategies can we use to help support somebody with their emotional well-being?
I think one important thing that we can do, and any carer involved and family involved, is to stay positive. Many people with Parkinson's lead active and fulfilling lives. So let's not pretend that they can do everything they used to do, but let's understand what changes we need to put in place and be positive about that.
Okay.
Staying active. I've talked about this several times, but finding leisure activities that a person enjoys and facilitating access to those leisure activities. We know that a lot of people with Parkinson's do struggle with their emotions from time to time, particularly actually when they're first diagnosed or when there's a step change in their condition. And we would say if a person is feeling stressed, to talk to their GP or their Parkinson's doctor or nurse about their concerns, and they may be able to help by signposting to other professionals or coming up with other strategies that may help a person. We know that Parkinson's can interfere with sleep. So if a person isn't sleeping, that can leave you feeling tired and it can leave you feeling down. So we can look at strategies that would help a person to get a better night's sleep as well, and that might help with their emotional well-being.
Okay, brilliant. And, you know, we've touched on the fact that this is a progressive disease. So, you know, from a caring aspect, what should carers look for as a person perhaps approaches end of life with this disease?
Parkinson's symptoms can vary from person to person as it progresses, but the one thing that we do know is that they are more likely to, the stiffness and the lack of mobility is likely to worsen.
Okay.
And that can bring additional discomfort to the person. And it may be that they're no longer able to mobilise independently. It may be that they need to be cared for in bed for some of the time, and they may need support with transferring. So we need to think about comfort.
Okay.
We need to think about pain management. We also need to recognise that it is more common for people with Parkinson's to go on to develop dementia. Doesn't follow that they always will, but it is a consideration that we need to be aware of. So it is, I would say, it is about supporting a person when they feel ready to talk about advanced care planning whilst they have the capacity to do so, so that we record what matters to them.
Yeah, hugely important.
Not just their needs, but what their wishes are and what their end-of-life care would look like from their perspective, so that we make sure we've got that in place whilst they're still able to communicate that.
Yeah. So we've touched a lot on the care from an official health and social care perspective, but what are some of the tips that, you know, we can give to help support family and friends of people living with Parkinson's?
Okay, I think it's important for family friends, family carers and friends of the person to understand the condition so that they can give the support that a person needs, to recognise how it will affect a person day to day and how that might change. Think about how their routine might need to change and when to offer them help. Recognise that they might be feeling a little bit tired. So think about the practical considerations for the person, but also really importantly if you're living with somebody with Parkinson's, try to maintain your own support network outside of the relationship with that person. It's really important for you to have somebody to talk to and for you to have an outlet so that you continue to feel strong yourself.
Yeah.
Think about your own feelings. Is there a support network that you can join? There are a lot of Parkinson's support groups, both for the person living with Parkinson's and also a carers network as well. So think about your feelings and how you can address those. I think be clear about what you feel able to do and willing to do. What can, particularly if you're not living with the person and you've got other commitments, what can I do to support this person, and what other networks might we need to get involved? And try to carry on doing things that you enjoy together.
Yeah.
Don't make an assumption. It's quite often the case that when a person is diagnosed with a life-limiting condition, it's very easy to think, okay, that's an end to us doing X, Y, and Z. But actually, what are the things that we can carry on doing together that we enjoy doing? And how do we find a way to make those things accessible to us? Because that's really important.
Sure.
And easy for me to say, but try to keep a sense of perspective. It's very easy, particularly when a person is diagnosed, to go to the worst case scenario and to think about all the things that might happen in the future. But actually think about, okay, what do we need here and now? What changes do we need to make, and what can we carry on doing?
Okay, incredibly valuable. Thank you so much for sitting down and sharing these insights with us. It's clear that caring for somebody with Parkinson's, particularly in a palliative setting, is about compassion, respect, practical support, and person-centered care, tailoring the care to the individual, because there's no one size that fits all. And to our listeners, join us next time as we continue to explore ways to provide person-centered care.